Did you know that diabetes can present itself in different ways? At night, there are common symptoms that can indicate prediabetes or early-stage diabetes. Do you know what these signs are? It's important because many people with diabetes don't know they have the condition. But diabetes is treatable and, in many cases, can even be reversed. That's why the sooner we discover it, the better. Identifying prediabetes can prevent it from developing into diabetes. And if you already have diabetes, we can avoid all the terrible complications associated with this condition. Let's explore the 9 strange signs of diabetes that appear at night, indicating the first symptoms of diabetes and prediabetes. Prediabetes is when blood glucose levels are slightly elevated, but not yet high enough to be considered diabetes. Now, let's get to the 9 main signs. Number 1. Blurred vision at night. High blood sugar levels can affect vision, especially at night. Difficulty driving in the late afternoon or at night can be a significant symptom. High blood glucose can disrupt the fluids within the eyes, causing the lens to swell and change shape, resulting in blurry vision. Diabetic retinopathy, caused by prolonged, uncontrolled blood sugar, is the leading cause of blindness in adults, damaging the small blood vessels in the retina. Number 2. Intense hunger during the night. If you feel intense hunger during the night, even after having a balanced meal, this could be a sign of diabetes. When blood glucose levels are high, the body's cells have difficulty using this glucose as a source of energy. As a result, the body interprets this lack of energy as hunger, even if you've already eaten enough. This can lead you to look for food in the fridge during the night. Additionally, the excessive presence of insulin in the blood, especially due to insulin resistance, can result in hypoglycemia, a sudden drop in glucose levels that causes intense hunger. Number 3. Restlessness in the legs. At night, you may have difficulty finding a comfortable position for your legs or feel a constant need to move them. Diabetics are at higher risk for restless leg syndrome, which can intensify at night. This can be due to diabetic neuropathy, changes in dopamine levels, circulation problems, or nutritional deficiencies, especially low iron levels. Number 4. Leg cramps at night. Cramps can be extremely uncomfortable, more common among diabetics, especially in the legs, and can wake a person up during the night. The causes include dehydration due to high glucose levels, electrolyte imbalances such as potassium, magnesium, and calcium, circulatory problems that reduce blood flow to the muscles, and diabetic neuropathy, which interferes with the proper transmission of nerve signals to the muscles. Number 5. Night sweats. If you've never had night sweats and start waking up with wet clothes or sheets, this could be a symptom of diabetes. Could it be mistaken for menopause or excessive heat? Yes, it could. When blood sugar levels are high, the body tries to eliminate the excess through urine or sweat. Additionally, diabetes can affect the autonomic nervous system, which is responsible for sweat production. Hypoglycemia and sleep apnea can also cause night sweats. Number 6. Burning feet. Have you ever felt your feet burning at night as if they were on fire? Sometimes it even disrupts your sleep, making you move your feet back and forth in bed. This discomfort can be a sign of diabetes. It can manifest as intense burning, heat, tingling, or a sensation of pinpricks, affecting the soles, toes, and tops of the feet. It's quite uncomfortable and sometimes painful, increasing sensitivity to touch. As mentioned earlier, diabetes can affect the nerves, resulting in diabetic neuropathy, which affects many people with diabetes. Number 7. Frequent urination at night. If you used to sleep through the night and now wake up 2, 3, or more times to urinate, it could be a warning sign. It's recommended to do tests like fasting glucose and HbA1c. Other possible causes include prostate problems in men, sleep apnea, excessive fluid intake before bed, or diuretic medications. However, it's crucial not to rule out the possibility of diabetes because high blood glucose levels increase thirst and, consequently, urinary frequency. Number 8. Feeling tired upon waking. Do you often wake up tired and without energy, even after a full night's sleep? This could be a sign of diabetes. When blood glucose levels are not properly controlled, it can affect sleep quality. If glucose levels are too high or too low during the night, it can cause sleep disturbances, leading to frequent awakenings and resulting in morning fatigue. Additionally, diabetes is associated with a higher risk of sleep apnea, where a person has pauses in breathing during sleep, which can be dangerous. Up to half of people with diabetes may develop sleep apnea, often noticed by someone sleeping next to them. Typically, sleep is not restorative, and the next day, the person feels extremely tired, fatigued, or even sleepy. If you wake up multiple times to urinate during the night or feel dehydrated due to diabetes, it's very likely that you will feel tired upon waking. Number 9. Bad breath. Diabetes can lead to dehydration, which causes dry mouth and worsens bad breath. However, fruity or acetone-smelling breath can indicate uncontrolled diabetes, especially if it persists during the night. This odor is known as keto breath, resulting from the burning of fat as an energy source instead of glucose. When blood glucose levels are very high and the body cannot use glucose properly due to a lack of insulin, it starts burning fat as an alternative, producing this characteristic odor. If you've found out that you're pre-diabetic and want to avoid becoming diabetic, what should you do? A study called DPP, with over 3,000 pre-diabetic people, divided participants into 3 groups. The first group made lifestyle changes, such as losing 7% of body weight, consuming fewer calories, and exercising for 150 minutes per week. The second group took metformin 850 milligrams twice a day. The third group received a placebo, a pill with no effect. Which group do you think had the best results? The group that made lifestyle changes reduced their risk of developing diabetes by 58%. The group that took metformin, one of the most common medications for diabetics, also had good results, with a 31% reduction in risk compared to the placebo group.